I think we're starting with Todd, and I'll turn it over to Todd Holmes.
Okay, thank you. All right, good morning, everybody. It's good to see several familiar faces, but I'm sure I may have bumped into a few of you in other meetings or whatever. So I've been here since June last year. It's a new position. If we could advance the slide, or do I do that? I do that, okay. Sorry. Okay, let's see. There we go. Okay, so I've been here since June last year, and this is a new position as well. But I've worked a lot overseas. I've spent a good part of my career overseas. I started out in Peace Corps and went to West Africa. Came back, I worked for Peace Corps in Boston and actually recruited a few people at MIT. A few folks went abroad. It was always a pleasure to get some people in the STEM programs overseas. And then I joined Catholic Relief Services as an intern, but then I got thrown right into humanitarian response work with Hurricane Mitch in Guatemala and Central America. After that, I moved on to Haiti. I really liked it. I stayed there about a little more than 5 years, went through the tumultuous Aristide when he departed. And then after that, I left. I went to Egypt and continued program management and was doing microfinance, emergency management, and several other projects. And then I transitioned full-time into NGO security, with covering the Middle East, Caucasus, and Eastern Europe. Continued the same with World Vision after that, and it was basically the same area, but I was given a couple more countries, Afghanistan, Pakistan, so I'd go to those places and work with the local security officer on security planning and responses, drilling, security assessments and whatnot, so we could keep staff safe and continue to work in those programs. And then I've come to MIT. Okay, so a lot of people see the world this way. It's just a basic map, color-coded, but there's no rhyme or reason to it. It's just to be able to distinguish the countries. However, in the security world, we tend to look at the world like this, risk levels. So this is basically 5 risk levels from low to insignificant low, medium, high, or extreme. So this actually comes from International SOS. So you can see some or parts of countries have, in the redder areas, are high risk. So, more considerations as far as safety goes. So Mexico's not, it's not monolithic. The same thing with, parts of Algeria and other countries in Brazil. So when I look at security and I ask questions, I really need to understand, not just the country, but where specifically our travelers will be going, because there's certain areas where it may not be. There's extra steps that need to be considered, especially before students can go in. So what do I do? Core services and support. Incident response. So I do have a core group of individuals I work with by function, legal, law enforcement, medical, insurance, finance, and media relations. So it's a core group. And we would come together for a really big, if there was a really big incident involving travelers overseas, to assess the situation, what else needs to be done, potentially make recommendations further up to senior management. But most of the incidents we've been handling, when we get notification through International SOS in a lot of cases, it's been the medical or something simple that I can handle with 2 or 3 people and go through, check they're okay, but also we don't need to activate the entire international emergency team, but it is there. It's a crucial part of the safety net. And again, for institute-wide crisis response. Monitoring, so I'm trying to keep track of a lot of countries going, what's going on, so I receive, especially for the countries where I know we have travelers going regularly, I do get alerts and I look at those and just try to stay abreast of the situation when somebody approaches me with a question. And then I'll also analyze and assign country risk on the MIT travel risk policy. So we base that on State Department plus CDC notices. So we look through those, and then based on the travel risk policy, I'll be able to say, okay, well, this area should be moderate risk, and what does that mean? This is high or this is extreme. And we also have, reviewing this, decision support. We do have a policy where if students do want to go, or they can request to go to a high-risk destination, there's a policy exemption process to go through, so I'll talk about that briefly, but it's not an automatic yes. We need to review it, and then we will provide decision support to the appropriate dean and the chancellor. And then also, as I've been here now in nearly 11 months, I am getting more and more requests as far as preparing information on, where, to prepare the DLCs and travelers related to risks. So sometimes I'll get a question, can we set up a program in Ethiopia? I'll start to do the research on that and then present the information to the program manager for them to make, further decisions or discussions. And then on the horizon, which we are working on, is a travel risk registry, and I think I've met a few people individually in departments to talk about that. So we're working closely with IS&T. Right now we rely on several systems, but we don't have a centralized database currently for all the travel. But with the student travel through the MISTI programs and the GECD, we've got, I would say, most of the travel for those structured programs in there. Okay, International SOS. So that's our overseas assistance provider. That's the assistance number we tell travelers to call when they need information or assistance. And again, it's a 24/7 alert center. They've got, there's the global number up there. It's a toll-free number. So we tell people to program it in their phones. You can download the app as well. It's very important to do. But students have the SOS services on MIT Business, financed or supported travel. For faculty and staff, you have it for business plus personal travel. And again, you can research country information, so you can look up medical and security risks as they assess it. They can also recommend additional service providers or service locations in country. They do evaluate those. You can sign up for email and travel alerts. Country-relevant travel risk information is very important there as well, so that may differ a little bit from how we present it in our travel policy. They have every country listed in the risks, whereas the travel policy is predicated on what State Department publishes for travel warnings and alerts. They do provide evacuation assistance as well for medical and security, but I've asterisked that because that requires a little more planning and thinking, because in certain countries, they actually will not go into a war zone. So if we had folks in Syria, we need to get the folks to a rendezvous point. So we may be looking to work with, in a situation like that, another local extraction provider on the ground to be able to meet up with the International SOS services. And then there's also a couple of other features in there that are available to travelers. There's a My Trip where you can register your travel, so that'll show up at International SOS. They'll be able to see it. You'll be able to get notices. Then there is also what's called an emergency record, so individuals can upload basic, confidential medical information, copies of passports, copies of prescriptions, in case they need to be accessed overseas. Okay. And then coupled with this, we do have, since last year in August, a student study abroad health insurance program. So that's $100,000 first dollar coverage with some exclusions related to extreme sports, military service. But it has to be activated through International SOS. So it's really important to make the call to SOS. They've got protocols, and they'll go through and contact the insurer as well. So we brought brochures as well, International SOS cards and student insurance brochures. Okay, so our travel risk policy, I've already mentioned a couple tidbits of it. It's based on State Department travel warnings and alerts, the CDC, and WHO. We have 3 levels. We have extreme and high and moderate. Students are not permitted to go to the highs or extremes unless there's a waiver that's approved by the chancellor to the policy. And there's several forms also that are important. So student would need to complete, even for a moderate level, just a risk acknowledgement form. The faculty and staff, we've got a form up there that they would just sign risk acknowledgement for high or extreme locations. So, we advise not to go to those locations, but we don't have any prohibitions on it for them. And occasionally I have worked with some faculty in my 11 months here now just to talk about some of the risks associated. And most of the time they're aware of the risks. They need to go there for research or projects, and they'll go and do it. We put them on a high-risk tracking list. So I've had one professor go to Iraq several times. So I'll check in with her. She'll check in with me to make sure she's okay. But I've reviewed all of the the safety net information with International SOS with the professor. And then I also want to just add, with the high-risk locations that are prohibited to the students, okay? It can be an entire country or it can be certain states or sections. So we have to parse that out in the travel warnings and alerts. Mexico and Israel are, every time they're updated, I've got to read through them painstakingly to make sure nothing has changed. There are parts of states where you can go and travel, and then other parts, based on how it's written, you shouldn't be going as a student. And again, the waiver. And I do want to add, though, all countries have risks. So it's not just, look at State Department information. It's really important to read what the Department of State publishes under country-specific information. So that's available for 200 plus countries. They have sections on legal, health, and especially safety and security. So they'll tell you more in detail about what's going on safety and security-wise, and maybe they'll also have information on where and how the embassy personnel can or cannot travel in country. So these are the countries right now with travel warnings or alerts. So this has nothing to do with health, it's just really security. So you can see a good part of Africa, unfortunately, but all of those countries have active alerts at this point. A few in the Americas, but mostly, again, Africa and the Middle East, and then the Ukraine because of the conflict as well. Okay, and then several countries in Asia. However, where are students prohibited from traveling unless they get the waiver? Okay, again, you can see kind of crudely parts of Mexico, most of Algeria except for a few parts up on the coast, and parts of the Democratic Republic of the Congo, parts of Nigeria, but the rest is just full country, or a bit of Saudi Arabia too. So that's right now parsed out through the information in the travel warnings and alerts, plus any other conditions in our travel policy. Okay, so again, some common threats that travelers deal with in the incidents that I've been looking at. We've had about 60 or 65 incidents called in since I've been here from June 1st last year with International SOS. So I see a lot of general travelers' illness, viral, microbial. Not a lot of accidents, but a couple of slip and falls. So those types of things can happen overseas. Road and transportation safety is one of the biggest killers overseas as well. So we do talk about that. And coming from a society where we drive on the right side, and if you go to another country where it's drive on the left side and it's different, people even get injured just crossing the street. They look the wrong way, and car comes and clips them or whatever. So things like that. But then there's also restrictions on driving as well. We don't want people to drive abroad. And then also other types of transportation and safety related issues. Lodging safety as well. We want to make sure people are staying in safe places. I'm not doing hotel assessments at this point. I mean, that would be almost impossible to do for one person. But when you think about lodging safety, it's really structural or fire, things like that, or where are you staying? Don't stay on the ground floor in hotels. You want to stay on the first floor. In countries where terrorism may be a threat, you want to stay further in the back, or you want to make sure hotels have standoff distances from the entrance where car bombs have gone into certain countries like Pakistan or Afghanistan. So there's a lot of considerations I'm glad to talk about as far as planning where folks are going and what to consider. And then crime. A lot of countries, just petty street crime, pickpocketing, but also some countries too that have more violent crime that travelers are that are exposed to. So those are just some common key threats to consider. Also, terrorism in certain countries. We do have a standing Europe travel alert right now from the State Department, which is pretty broad, but it's just warning of the increased threat of terrorism, and that a lot of the countries in Western Europe are on higher alert. And but that will be expiring in June unless they renew it. So about towards the end of the month. But I monitor that, and those are all listed as well, specifically on the travel risk policy. But there's no European country that's specifically listed. And then sudden onset natural disasters, we can have individuals affected by those. So we did have an earthquake in Nepal last year. I believe we had maybe 1 or 2 travelers there. And other countries which are more seismically active, so those are considerations when they happen. as well. And then also there's some volcanic activity going on in Central America I've been paying attention to now, and we've got, I believe, some folks considering going to El Salvador near, somewhere in that area. So I've been talking about that with the program manager as well. And then know before you go, just some basic standing travel advice I'll refer to, and it can be very broad, but it's more specific to the area in the country that you're going to. We can find some of the information in the State Department information, but also very detailed, very good standing travel advice comes up in the International SOS. When you look up specifically your destination, the country, they may even have specific cities that are covered as well. And again, the whole purpose to have standard operating procedures is really to avoid getting in an incident. So, they're carefully thought out, and if you follow those, the protocols or whatever, you should avoid getting in an incident. But what happens if, once there, something happens? You need to have a contingency plan. So a contingency plan can be designed prior to the trip, but it should be reviewed in country in case conditions may have changed. And you really need to understand, how are you going to get help? Okay, where are the safe places you can get to? And then how to get out if needed. But in any case, what we still tell people is you can call International SOS Travel Security, and they will start helping you right away as far as destination, what do you specifically need. They'll contact me. I get the 3 a.m. phone call, and I'll probably, I'll activate the team if it's really critical. Okay, and some major and recurring concerns right now, the pandemic. So Zika, that's been a topic we've been discussing at least since last fall. So those are listed on the CDC site as a level 2 alert. So what we're telling travelers is it's really about prevention. We're not prohibiting travel to the Zika countries, but you need to understand what you can do to prevent the mosquito bites. So my suggestion is, and it's important, MIT's Travel Health Clinic will help prepare the travelers before they go. So they should be going to see the Travel Health Clinic, get the information, get the appropriate repellents, clothing, most likely mosquito net, and then understand what the symptoms are, monitor for those. If you feel sick once you're abroad, whatever illness, call International SOS, okay? And then a couple of other diseases that are showing up on the CDC site right now are the MERS-CoV, but that's mostly in the Middle East, and then there's some polio going on in Africa. So those right now are the bigger concerns. There is no CDC. The highest level at the CDC is a level 3 warning, and that was Ebola, but there's none right now. Okay, and if it were, then that country would be restricted. Severe weather events. So right now, people are getting ready to go abroad, and if you're going to Central America or the Caribbean or even parts of Asia, you've got the monsoons, the typhoons, the hurricanes. So those were going on last year, and I was constantly looking at the lists of students and then contacting the program managers and just providing basic advice, contact where to go, shelters, those types of, just types of basic information that the traveler should be aware of, plus being able to check in. If something hits, check in before, check in after with the program manager. I wasn't checking directly with the students. I was fortunate to have a program manager to work with. Then the global terrorism threat. Right now, State Department still has the worldwide caution, so that's been out since before I came to MIT last year, and that was just renewed again and briefly updated. And then again, I've referred to the travel alert right now, which is going to expire on June 20th. Okay. So some basic preparation guidance. Look at the travel risk policy first. Okay, that's just to understand in general the country list. So please look at that. I always also ask people to look at this country-specific information, as I previously mentioned. If there is a travel warning or alert, read through that. And again, they can be a little bit complicated to parse, so please call me, and I'd be happy to help explain it and work through it with you. Okay, and then really important to stay informed. So sign up for the State Department Traveler Enrollment Program, the STEP, which is free. Also International SOS country email alerts on the member page, and then you as well, the DLC contacts, to have the contact information once they're overseas. I think it's really challenging, especially when we're talking with the travel registry stakeholder group, about We have everybody's emails, but their numbers may change overseas. So it's really important. We have to insist on when somebody goes overseas and they may switch out on a number, we have to get it from them. And I mean, that's the best way to be able to reach out to somebody for the most part. Relying on social media can be helpful in certain cases. And I know some departments, they've got, when they go over with a group, they may have a WhatsApp group set up. But recently there was an issue where WhatsApp was shut down by the judiciary in Brazil. Then I just read a headline this morning, I think it may have been rescinded. But you know, if that had been part of somebody's standard operating procedure to keep in touch with the program manager with the student group, WhatsApp is no longer an option, or it was removed. So those are important considerations to look at. And then we are requesting and asking student travel data be sent into the Global Education and Career Development Department. That's a key list that I work with, including the MISTI list. So most of the people are on those two lists. Okay, and then enrolling with STEP. Just a couple of cautionary points on this too. U.S. citizens, it's set up for U.S. citizen travel, so you register your passport number, but foreign citizens can register as well. You just can't put your passport in, you can put your email in. You're all going to be getting the same embassy security messages and alerts through that. However, we would also tell foreign citizens, if your country has a system, your embassy has a system in country you can register with, you should also register with that one. But the one that we're going to react to will be the information from the U.S. government, okay? And the Department of State, though, it's not going to come back and say, we've reached out to your travelers or whatever. I actually sign up for a bogus trip. I go in, I have my ID already. I make a trip, I put it in a comment column because in case they're looking at it, a consular official's reading it, they're going to see, well, Todd Holmes said he's in El Salvador, but I've also mentioned, no, this is a bogus trip and I'm doing it because I have travelers there and I want to know what's going on and receive your information. So that's something you could do as well. I would advise that if you know they're going there, create a bogus trip and you can see at the same time what they're getting as well. And again, no matter what your nationality, again, call International SOS. That's why we have it, so we don't have to worry about whose passport and who gets what service. The U.S. Embassy by law can only offer services to U.S. citizens. However, we go through International SOS and we don't need to worry about that. They're providing the assistance across the board.